The medical plan provides high-quality coverage for enrolled employees and their eligible family members. It includes comprehensive benefits, including preventive care, personalized support for navigating healthcare, hospital, surgical, and behavioral health benefits, prescription drug coverage, and special features to improve your health and well-being. 3 coverage options are available: a preferred provider organization, PPO, an exclusive provider organization, EPO, and a qualified high-deductible health plan, HDHP. When choosing an option, it's important to consider your healthcare spending and how often you use healthcare services. All 3 options are the same in many ways. They all use the same National Blue Cross Blue Shield network of doctors, hospitals, and other healthcare providers. They all provide 100% coverage for recommended preventive care when you use network providers. They all provide personalized support for navigating healthcare. They all cover the same types of medical care and treatment if you are sick or injured or diagnosed with a health condition. They all give you the freedom to see any network specialist without a referral. And they all give you access to the Employee Assistance Plan, or EAP, Call to Health, and other benefits to help you improve and maintain your health. There are 6 key differences in how the 3 options work. While PPO and EPO work similarly, the HDHP is different. The first difference is network coverage. Only the PPO covers out-of-network care. Out-of-network means the provider does not participate in the Blue Cross Blue Shield network. With the PPO, you may use out-of-network providers and receive benefits, but your out-of-pocket costs will be higher. The EPO and HDHP do not cover out-of-network care, except for emergencies. So when choosing an option, you'll want to check if your doctor is in the network. The second difference is costs. There are 2 types of costs you should consider: the monthly cost for coverage and the costs when using your benefits. First is the monthly cost for coverage. Your employer will tell you the cost for PPO, EPO, and HDHP coverage, and your contribution is deducted from your paycheck. Generally, when you pay more each month for coverage, you pay less out of pocket when you receive care. As you consider which option to choose, consider your overall health expenses and if you prefer to have more money taken out of your pay now in exchange for lower costs when you visit the doctor later. The other costs you need to think about are how much you will pay when you receive care. In other words, how much will you pay in the form of copays, deductibles, and coinsurance under each option. The third difference is copays. With the PPO and EPO, you'll pay a flat dollar copay for primary, behavioral, and specialist office visits, as well as urgent care visits and teledoc. For the EPO, copays also apply for basic diagnostic services like X-rays and outpatient lab tests, advanced imaging like CT scans and MRIs, physical, speech, and occupational therapy, and chiropractic visits. The HDHP works very differently from the PPO and EPO in that no copays apply for any medical services when you are sick or injured. So with the HDHP, instead of paying a copay for doctor's office visits, you are responsible for paying 100% of the cost for your care until you've paid your annual deductible. The fourth difference are deductibles and coinsurance. For covered services that don't require a copay, you are responsible for paying an annual deductible and then coinsurance. Since the HDHP does not have copays, all covered medical services are subject to the HDHP deductible, except preventive care, which is covered at 100%. All options have an annual deductible. Under the PPO, the deductible amount is based on a percentage of your effective salary. Under the EPO and HDHP, the deductible is a flat dollar amount. The HDHP has a much higher deductible than the PPO and EPO. If you cover any family members, the deductible works a little differently depending on which option you choose. Under the PPO and EPO, you are responsible for 2 medical deductibles. one for yourself and one for all your family members combined. With the HDHP, there's one family deductible amount that applies for you and your covered family members all together. For all options, you can qualify for reduced medical deductibles next year by completing Call to Health. Once you've paid your deductible, coinsurance kicks in. Under all three options, your coinsurance is 20% when using network providers. The fifth difference is prescription drug coverage. The PPO, EPO, and HDHP use the same drug formulary, which is a list of preferred medications chosen for effectiveness and cost. However, there are differences in coverage, except for certain excluded drugs. The PPO typically covers medically necessary drugs that are not on the plan's formulary, although you'll pay more out of pocket for these non-formulary drugs. The EPO and HDHP, on the other hand, do not cover non-formulary drugs. If you take any medication on a regular basis, make sure the drug is a formulary drug before enrolling in the EPO or HDHP. The final difference is out-of-pocket maximums. All three options protect you from catastrophic costs by placing a limit on how much you will pay out of pocket in a year in the form of copays, deductibles, and coinsurance. This is called the total maximum out-of-pocket amount. All three options have the same total maximum out-of-pocket amount. The PPO also caps the amount of coinsurance you will pay in any 1 year and has a separate cap for eligible prescription drug expenses. The EPO and HDHP do not have these limits. One other thing to consider when choosing a plan is that if you enroll in the HDHP, you may be eligible to set up and contribute to a Tax Advantage Health Savings Account, HSA. HSA funds can be used to help offset eligible out-of-pocket medical costs, including your deductible and coinsurance, or save to pay for future healthcare expenses. An HSA is not available for members in the PPO or EPO. However, if you enroll in the PPO or EPO, you may be eligible to contribute to a healthcare flexible spending account, or FSA, if offered by your employer. Remember, it's important to think about the big picture of your healthcare spending when choosing among the three options. Instead of simply picking the option with the highest or lowest monthly contributions, consider how frequently you use healthcare services during the year and the type of services you need. Do the same for any family members you plan to enroll. Not sure which is the right plan for you? Visit pensions.org/medical for more details about the PPO, EPO, and HDHP, or call 800-PRESS-PLAN.